Hello and Assalamu alaikum, Ultrascan Diagnostics. Here is the CBCT of the patient that you had requested. The area of interest is all the areas where we have e-digital spaces. So if you look at the upper right bridge, starting with that, we've got furcation involvement with a little bit of a disto-buccal root involvement, no periapical radiolucencies in the upper right 7. The upper right 6 has no bone for implant placement. The upper right 5, which is a peer abutment, has the endodontic treatment with radio opacity beyond the apex. We're presuming that to be cilia, but no radiolucencies can be seen. Then we move to the region of the premolar. We've got a very adequate ridge here, D3 quality bone, but 7 millimeters of ridge with 13 millimeters of height. This is the upper right canine endodontic treatment with a slight bit of periapical scarring, not a periapical radiolucency that we can see. Now we quickly move to the upper left segment. The upper left segment we have a 4 which is endodontically treated. No periapical radiolucencies, cilia beyond the apex, no major pathologies. The 5 and the 6 don't show any bone for implant placement. And then moving to, my apologies, the upper left 5 is where we have the bridge mesial. The 6 and the 7 have no bone. We have the 8 involvement here with this furcation involvement, but no pathologies can be seen. Now this is the region of the lower left 4. As you can very clearly see, we've got D1 quality bone, very dense bone, 10 millimeters of width with approximately 9 millimeters of height to the anterior loop of the inferior alveolar nerve. Then we move to, this is where the nerve is exiting in the region of the 5. We've got very limited bone. I'm going to zoom in for the doctor so that they can see clearly. This here has D2 quality bone, very dense bone again, 10 millimeters of width, but only 6 millimeters of height. So a shorter implant, but there will be vertical augmentation needed. In the region of the 6, we've got again a very thin ridge generally, but thicker ridge if we go deeper, and a ridge with a height of 7 millimeters. D2 quality bone. Now on the region of the lower right canine and the lower right premolar, first premolar region, we again have a knife edge ridge, but 8 millimeters of width with approximately 8 millimeters of height. In the region of close to the nerve, we've got again 9 millimeters of width with 9 millimeters of height. And if you go to the region of the 5, again very limited bone in terms of height, 10 millimeters of width with just 5 millimeters of height. Moving to the region of the 6 here, again the ridge is thick enough but does not have sufficient height. We only have 5 millimeters of height to the inferior alveolar nerve and D1 quality bone.